All right, welcome to part two of today's John McIntyre Show live. It's so funny. We actually had some serious technical difficulties with the power. Actually had the power to blink here in the area, and so after looking at everything, and I had to edit some of Andrea's language out. I was like, let's just do a show. Let's just do it all over again because we don't want to make sure we give clean, clear information here with this topic because this is so it is sensitive and we're not trying to confuse anyone with this particular situation with this topic here. So, Andrea, we was talking about preparing for the Medicare annual enrollment.
Absolutely.
Okay.
So, with preparing for the Medicare annual enrollment, one thing that we want to make sure that we're doing is that we understand that right now we're going to be getting a lot of mail. So
Mm-hmm.
there's mail that's going to be coming in, the normal advertisement and regular bills and things, but it's also an election year, and so you'll have the election information for
Mm-hmm.
for our government here in the United States, but then you also have Medicare Advantage plan annual enrollment period. That information is going to be coming. So you may receive information not just from your current plan provider, you'll be receiving information from other companies who also provide Medicare Advantage plans. And we don't want you to get confused because there's something very, very important inside your mail that's coming from your Medicare Advantage plan provider. And that's what's called an annual notice of change. And this
Right.
is really important. You may open your mail over the trash can or recycling bin, but we want to caution you that you put advertisements to the side and anything that's in envelopes that you separate that so you can be very careful to not throw away the wrong information.
That's right. Because annual enrollment it starts um, October the 15th, ends December the 7th. So that's the time to where people that are on enrolled in Medicare Advantage plans, they can change. They can switch plans or they can stay on the plan that they choose to because Medicare Advantage plans aren't like Medicare Supplement or Medigap plans insurance. Medicare Advantage is calendar year. It runs from calendar year from January 1st, December the 31st. That's how it runs. And so each year you have to do the annual enrollment period. That's it's called the annual enrollment period, and you have that window of time to actually, if you're going to change, make changes, or at least look at new plans.
Absolutely. So I want to bring up a couple of points. So one, you'll be getting that annual notice of change. It may also be called the Medicare Advantage summary or notice of change. Regardless of what the name is on the envelope, what that
Mm-hmm.
is really saying is here's a notice of changes that may be happening within your plan. And this
Mm-hmm.
could be your coverage could be changing. They may add more coverage or they could change or reduce some coverage. It may also include the cost. So the cost could change for certain types of services that the plan provides.
Right, right. So when does that actual letter come out? The annual notice of change. When should they receive it? Is it like this time or right around this time, or when do they receive that actual
That's a
notice?
good question. So it comes out every fall, and that's vague, but really the time frame I would say between the end of August, usually through mid-September, usually
Yeah,
about around September
depending
15th,
on the
20th.
company, right?
Yes. And I'm glad you mentioned depending on the company because anytime there's any type of change or updates in your benefits
Hmm.
or within the company or plan, they're
Hmm.
required to give you at least a 30-day notice so they can let you know something's going on. Well, what's different about this is companies they generally are going to send out this information to let you know what's happening, and everyone should keep in mind this does not go in effect immediately or within 30 days. It's for the new plan year. So January is when these new changes happen.
Right. Okay. Okay. Yeah, that's good because plans run, like I said earlier, a calendar year. Um, and you won't have to worry about any surprises because the way that it works, CMS, which is the overseeing governing body of Medicare, they um, have to approve of every plan. Every company that's planning to do provide Medicare Advantage to beneficiaries, they have to be approved by CMS,
I'm glad you
and so
mentioned
they
that.
have to submit their plans. Their plans have been submitted because they're trying to respond to the market because Medicare Advantage, we covered that last week, but just for making this point, uh, they are regional, and some are even ran by zip code. And so the companies are constantly getting feedback from the providers, the doctors and other specialists of what's going on. So if something changes with the demographic, health wise or something, then the plan knows to respond to that particular area. So it may not be a big problem of diabetes in one part of the country, but in another part of the country diabetes could be kind of high. And so they respond to that type of stuff. And so once they've responded and they make changes to the plans, then they have to submit it to CMS. CMS has to okay it. Then they communicate. Sometimes the brokers, the ones of us who are involved in the industry, we we will receive updates, but we don't really talk about many of them because we know that you should be receiving the annual notice of change yourself to read for yourself, and we don't want to like confuse the situation.
Absolutely, because we were talking about last time that you could be talking to your neighbor or
Mm-hmm.
another relative who also has different types of medical plans, and what may be specific in their plan within their zip code may not apply to you.
That's
So
right.
I've talked to people many a times, and they'll ask for a specific plan or service
Mm-hmm.
or some type of feature or benefit that could be in their sister's plan, but when we look in their zip code, that may not be available. So it there we know in general some of the changes that's going to happen, and we'll
Mm-hmm.
talk about some of those, but we always want to make sure that we're looking at what is for your specific plan because it could be different.
That's right. That's right. All right. So we cover it. What does the annual notice of change cover? When does it come out? So the beneficiary, they have their letter in hand. Now what?
I'm glad you asked. So within that, you want to make sure that you stop and you think about how is my overall health. And this is not a judgment. This is really for you to look at, okay, was my health the same? Did it get better? Maybe you've started walking more and you've lost a little bit of weight.
Mm-hmm.
Um, some of your medications, maybe your doctor has said that you need to reduce, we're going to change and lower the prescription, or maybe there's something that's happened that we need to increase that. So surgeries, anything that's going on that could impact you as far as your health with specialists and your primary care physician, those are the things that you want to look at. What's happened over the year, and
Mm-hmm.
then what have they talked about that um, we need to schedule or plan for?
Mm-hmm.
Because that's going to be very important on whether or not you should do that in this current year, 2024, or if it's something that you should wait to do in 2025.
Yes, yes, that's exactly right. So there's a lot of things there's a lot of decisions to make as far as the plans are concerned because things change. Times we're not the same person we are last year. We could be better or we could be not so good, and so we have to take all of that into an account when we're planning to look at these new plans that will be coming out.
Absolutely. So, a couple of other tips that I highly recommend that the beneficiaries, kind of walk through when they're looking at this, and whether it's you as the beneficiary, you're a caregiver, or just a concerned, adult child.
Hmm.
Uh,
Right, exactly. Right. I'm with you saying that because I'm doing that now. We're actually working through with my dad, get preparing to look through his plan for next year. He chose Medicare Advantage, years ago. Well, there's a lot of changes some were good. That he was actually able to come off of medication. But then on the other side, we may have to look at maybe some new equipment that may
Mhm.
be coming down the pipelines. And so I'm having to make sure to look through his plan to say, okay, will this plan actually cover that, or is there another plan out there that will take care of that? And that's what we're working through now with with my father.
Well, I'm glad you shared that from a personal standpoint because it affects us all.
Hmm.
So, whether you're the beneficiary and you're looking at what your plan provides and what your health and needs have been for this year, or you're the caregiver, maybe you
Hmm.
are working with the public, maybe you are within public service within a doctor's office or a nurse, and these are some of the things that you'll probably be hearing some of the patients talk about or ask questions about, and that's because it's the annual enrollment period.
Right.
So when we talk about what are some other things that you could be looking at, I would say when I mentioned your doctors and specialists, talk with them about what they have planned for you. Is it a good idea to do it this year or wait till next year?
Hmm.
Um, you also want to talk to them about the medications because what some
Oh
medications
yes,
may
most
have been
definitely.
prescribed by your primary care physician or they may be prescribed by your specialist. So you want to look at that because it could impact who prescribes something, may impact the cost, the
Yes,
copays.
that's true. That's some of the changes we can actually. One of the changes we can actually talk about. It's already out there. Is you mentioned it with the prescription drug plans, like the donut hole is going away. It's just going
Yes.
to cap it at $2,000, something
Yes.
like that.
Hmm.
Where it used to be, you went here, you went into catastrophic, you went into the hole, then you went into catastrophic things like that. It was periods where you paid more, then you didn't pay anything. This all of that's going away. Is basically is going to hit a cap and you're done.
Hmm.
And so that's one of the changes to be on the lookout for, and that can be a big benefit. It can actually lower the cost of medications of a particular person's medications. So that's to look out for. And we're just stressing to be ready for change because a lot of changes are going to happen these next few years. They've already CMS, the companies, they're already talking. These next few years are probably going to see be some. You're probably going to see some of the biggest changes in Medicare than any other time period because they're having to really update some things. There's some things that they should have updated. um with some of the care that they provide is some care that's not provided simply because back when um Medicare was actually created by the government back in what the 60s.
Hmm.
uh, they still operating like it's the 60s.
Yes. And I'm glad you mentioned that because there's some things that are part of just our regular care
Hmm.
that when we think about care, when we think about our benefits in medical, most of us, and I'll just say my generation, I'll just
Hmm.
put it that way. So for my generation, when we think about overall health, we think about your medical healthcare benefits, going to the doctor, specialist, emergency room, whether it's teledoc or urgent care or something
Hmm.
like that.
Hmm.
We also include under our umbrella as part of basic care needs, vision and dental. Well,
Hearing, all of
uh,
that good stuff. Yeah.
all of those things are very important and common in our day to day. But when original Medicare was created and they were thinking about those benefits for retirees, eventually, dental was, unless it was a major emergency,
Hmm.
most of the dental things that we consider common, they were not considered common when they were creating it.
Right. Exactly. And it hasn't really changed that much, which is why some of the companies stepped in with the advantage plans and say, hey, we'll provide some services. And so this is actually, they evolve and they are doing their best to respond to the market. What's most important. Me personally, I think that they're a little bit slow with the response. I think the beneficiaries has been letting them know what they need. But that I don't own the companies. I'm on the beneficiary side. It's our side is our job is to protect our clients and our beneficiaries, and keep them informed and educated and make sure that we guide them in the right direction. So we work with what we have and help you guys make the decision for your particular situation. Um, and you was talking about some things to look into. For instance, you may want to look into next year, will I be traveling? That could be something that could um, help you decide what plan may be right for you. It was at one point in time, a few years, not quite 10 years ago, there was only one plan that provided services if you went outside of the country.
Yes.
If you traveled
Hmm.
outside of the country, outside of the what they would call United States borders and protected, territories,
Territories. Hmm.
uh, you were just basically out of luck.
Yes.
Except for this one company, they had an actual passport.
Yes.
So if you had an emergency, you was in a different country, you could actually use that passport. Well, the other companies have responded because the beneficiaries were like, okay, hey, we need this, unless or the companies had to maybe deal with a mass exodus from their plan to go over here to this other plan that was providing that, and so they responded. So I said that to say they're constantly, trying to respond and anticipate what the beneficiaries would be needing, which is to say beneficiaries have a little bit more power than they think. They can
So speak
actually,
up.
yeah, so actually speak up. We do the best we can to protect and inform and educate, but there's a lot more that you could actually do yourself, like making calls and say, hey, I need this, and they'll take it into consideration.
So one of the ways that they do that is you can share that feedback with the with your doctors, your primary care providers
Mm-hmm.
and specialists, letting them know, this is something I wish my plan provided. You can
Mm-hmm.
let your agent or broker know. Sometimes you'll receive questions or surveys they ask you to stay on after a
Oh yes,
call,
most
or they'll
definitely.
send you
Oh
an
yes.
email following up. Some people don't like filling out surveys. I completely understand it. I would encourage you, when possible, to fill those out, because that information it gives them data for them to show, hey, this is something that people want. This is something that people need.
Oh yes, and social media now is just a quick visit their social media uh, page, Facebook, whatever, whichever one you use. Mainly Facebook is where a lot of this you see a lot of this, and make that suggestion. Put it in the comment section. Hey, I would like to see more of this. Um, there are 68 million, what is it, 68 million beneficiaries on
Yes.
Medicare now. So 10% of those, 10% of you guys say something, they don't have a choice but to listen. It's a lot, over 6 million of you say something. Hey, and that's all we need, maybe 10%,
Mm-hmm.
and that could be a lot. I don't think that the beneficiaries, the boomers, and the seniors understand just how large of the population. They're the largest part of the population.
Mm-hmm.
So they
And it's
have,
growing.
and growing, exactly, to
Mm-hmm.
every day 11,000 new Medicare beneficiaries turn 65. So just really think about that.
So you have power in numbers.
Mm-hmm.
Your voice does matter. So
Mm-hmm.
share that type of feedback. John, I want to bring us back to some of the other suggestions or
Yeah.
tips
Okay.
for preparing for the annual enrollment period. So we talked, just to recap, we talked about the annual notice of change,
Mm-hmm.
or Medicare Advantage plan summary of changes. This is just letting you know, based on your current plan that you have, what's going to be changing. This could be cost, this could be coverage. If you have a plan that includes the prescription,
Mm-hmm.
then it'll let you know that will be what changes will happen with your prescription drug plan portion of your plan. If you have a separate prescription drug plan, then you'll receive a annual notice of change from the drug plan company.
Right. Okay.
So you
Okay.
could
Because
receive
that's
more
what.
than one.
Right. That's because people that are on Medigap supplement plans, they're still on Medicare. They have the Medigap plan and have a separate prescription drug plan. So they will be receiving their updates that way. And even on the supplement Medigap side, they're receiving updates like increased premiums and things like that, because there's a lot of people that are being priced out of their Medigap and supplement plans because those carry, pretty heavy premiums, and they are increasing, and so they receive their updates, and it says, we're going to go from 105 to 115 or 120 or whatever. Well, some people, they can't handle the hit, or it can be a much drastic increase, especially those that have been on those plans for quite a bit of time. And they were like, hey, when I first got on this plan, it was $90. It's getting up to 150, 160. I'm beginning to reconsider. And so those are things they're having to take into consideration. But over here on the Medicare Advantage side, some Medicare Advantage plans have prescription drug plans, some don't. The majority of them do, but there are a few out there that don't have an actual prescription drug plan. And so, to your point, they receive, you may, if that is your case, you will probably receive an update separately.
Exactly.
So we're just saying this to really stress the mail's coming. A lot of mail is coming. A lot of the communications are going to happen. So don't be so quick to throw the mail out. Don't be so quick to hang up the phone, and make sure and watch for the emails to make sure that you don't miss something.
Absolutely. Absolutely. So I'm glad you brought that up. So you'll get those notices. We're recommending that you talk with your primary care physician, any specialists or doctors that you see, and look at how your health has been over the course of the year. Is there any planned surgeries? Is there anything that they're planning within the next 6 to 9 months that maybe you should complete in 2024 instead of waiting to 2025, especially if there's something that the coverage may change or the cost may change, or let's say the benefit becomes available and right now it's not. So those are things that you really want to make sure you weigh those options. Your medications, it's really, really important that you're looking at your summary of benefits or explanation of benefits that you received after your meeting, after your doctor's appointments. It lets you know the medications you're on, why let's say you forgot, why did I go to the doctor? Or what all did they say? That summary and explanation, it will provide a quick little overview of what was covered during that meeting. And it'll remind you, hey, here are the medications that we have. If they prescribe something new, or you have something in your medicine cabinet that is not on that list, you might want to call your doctor to say, hey, do I still need to take this? Just wanting to make sure.
Right. That's right. And speaking of doctors, the doctors may decide, I'm not going to accept this plan next year.
Yes.
So that is something when you talk to your doctor, say, hey, are you making any changes as far as Medicare plans go? Because we see some, it's a lot of, especially with some plans, there's some weird things that can happen inside of a Medicare Advantage plan. Case in point, all doctors could be in one building here in the Charlotte area. We have the Caramont. That's the largest.
An Atrium.
But Caramont is the largest. These doctors can be in the same building. They can actually be in the same practice, but one may accept it and one may not.
Absolutely.
And so those are types of things you have to take into consideration. That one was the like craziest. I give you the perfect story. It was with someone, they was going to enroll in a plan. And all of the doctors that they were visiting, the reason why they was going there is because the doctor, the primary care physician, the specialist, they were like all on the same, in the same building and everything. And then this one specialist decided that they were going to increase their fee. So if you use this particular specialist that did the same thing across the hall, they would see you for $35 copay. This doctor right across the hall decided that they were going to increase their fee, their copay to $55. Well, a smart one that was in a totally different building was like, hey, I'll come over there and see those patients for $35. And it was just that weird. It was that weird to me. I'm like, these are all in the same practice. They were under the same name, not over here. This one's operating as this one's operating. They were under the same umbrella.
Absolutely. And one thing to point out is the doctors who may be part of the same medical umbrella.
Hmm.
Let's say they're with ABC, um, ABC United. And so ABC United, all of them are a part of that network. The doctors, their practices, they can operate a little bit different because um, they have their own specialties and they can do some of their own particular rules. For example, the cost that you gave. So
Yeah.
ask the questions. That's what we're saying.
That's what we're saying. Make sure you ask those questions. You're looking at the plan. You have enough time now. You have a little bit, almost 2 months, a little under 2 months to actually just have that quick conversation. And it's a phone call.
Hmm.
You don't have to talk to the doctor. You just talk to the receptionist because they're mainly the one that handles it anyway.
Yes.
Of letting them know, hey, getting ready to look at this new plan, or I'm going into Medicare, something like this. Want to know, what do you accept? Do you accept this plan, this particular plan? And they'll say yes or no, and they'll give you what they would. Oh, well, our copay would be this, or whatever. And so that's what we want to do. We just want to just give you some quick preparation tips. We don't want to overwhelm you because there is a lot, and we all know this. There's a lot to Medicare. Like I said before, like I said last week, the wealthiest people that have built businesses worth $10 million, and they're saying this stuff is confusing.
Yes. So we want you to take a breath
Yeah.
and just
Yeah.
take it a step at a time.
Hmm.
So you've
And
talked
we're
to,
here. Yeah, we're
yes,
definitely here. You
absolutely.
contact us, give us a call. We'll do what we can to walk you through, help you, answer those questions. And the services are free.
Yes. So I'd also want to make sure that I point out we've talked about those helpful tips. Some other ones are we talked about we're available. If you are already working with an agent or someone, agent or broker, also reach out to them. This is one of the services that they should be providing to you as one of their clients. If you have problems reaching out to them and working with them, that may be a signal that you may want to look at some other options or find some other help.
Yep. If
Uh,
you make the call and they say, well, just call the plan, uh, they're basically saying, hey, I've done what I'm supposed to do, this, that, and the other. Where, you call us, a group like us, we'll say, okay, you don't have to call the plan. We'll make the call.
mhm.
We'll make the call. We've had to do it.
Absolutely. And another option as well is cms.gov.
Yep. Oh,
So
yes, most
their
definitely.
website, they also have phone. They have a phone line as well. They can provide some assistance. So we want to let you know that you have resources. Just get your information together so you can begin thinking about what's going on with your plan, what you have health wise, and be prepared for those changes that will happen in January 2025. And before going into AEP within October, you'll be able to decide, okay, based on the changes, I I don't think I need to make any. I'm good with the plan that I have. Or you may uncover that the plan that I have, it's not going to provide me what I still need for my health moving forward, and maybe I need to make a change to a different plan, whether it's with the same company or somewhere else.
Right. And this being Friday, normally I would use Fridays to recommend books. And I do have a good book recommendation for you. It's called the Medicare and You book. If you're a beneficiary, you have received a Medicare and You book. A lot of that information is actually in that book. Um, I know that most people just will not read it. I have my father. I go and I'm like having to sort through. I'm like, where's your Medicare and You book? Oh, they're over there. I go and it's a stack of, and I'm like, okay, well, why haven't you thrown these away? Oh man, I haven't looked in those things since he knew that I was going to be there and he could just ask me and everything. But for those that may not, you might be looking for some easy reading. Break out the Medicare and You book. It is a valuable resource.
I'm glad that you brought that up because it's one of those things that we're all guilty until we need something or we get a bill. Sometimes we don't look to see what benefits we may have before going into something, or we get the bill and then we're rudely surprised that,
Mhm.
oh, that's not fully covered.
That's
So,
exactly right. All right, so I think we've given enough information for today. We'll be back next Friday for another Medicare segment. And if you do have questions in the meantime, don't hesitate to contact us. We'll do our best to answer the questions for you to get you ready for this upcoming AEP. There may even be people out there that could be aging into Medicare before AEP. That you have a special election. That's your open enrollment. Your initial enrollment period is what it's called, the IEP. And so you don't have to wait till October the 15th. If you're aging in soon, even before then you could call and just start asking questions now, which most of the prudent ones, we get those calls about 3 to 6 months before turning 65. The phone starts to ring. Hey, I'm not 65 yet. Well, you made the right decision. Get prepared, because these are some big decisions, and they are decisions that will affect your year. So
exactly.
you want to get them right. And if you're just coming into Medicare, some decisions you make will be permanent. Once you
Yes,
make them, you can't reverse them. So this is a very important time. This is the health care that you will be using for the rest of your life. So that's why we're doing what we do. We get a lot of questions, so that's why we're dedicating Fridays to Medicare. And if it takes more time, more days, then we'll just have to expand to take care of it. So, Andre, if you don't have anything else, we'll do the question of the day and then we'll sign off.
I don't have any other. I think that we've given a lot of valuable insight. Uh, you're able to watch it again. You can share it with others,
Hmm.
and again, don't hesitate to reach out by phone or messaging in the chat on YouTube or on Facebook. We're happy.
Yes, because I like to share wallet wins, even though I didn't share any today, because we want to make sure we keep it focused on Medicare. But I would love to see Medicare wallet wins. Hey, I made the right plan. Hey, I switched plans. Hey, I finally got the right prescription drug plan for me. Those are wallet wins also,
Yes.
because that's healthcare.
Hmm.
So share those also. Well, we'll do the question of the day and then we'll sign off here. So the question of the day is, have you received your annual notice of change? That's to get you to go back into that mail, dig back into the mail that I know probably haven't thrown away yet, um, and look for maybe the annual notice of change. So that is the day's question. So I want to thank you for tuning in. On behalf of myself and Andrea, we'll see you Monday. Hope you have a great weekend. We'll talk.